President Trump is receiving heat from some Republican lawmakers who say his planned vaping ban would harm small businesses. The president announced plans to restrict the tail of non-tobacco flavors of e-cigarettes last month. According to administration officials, the crackdown would require companies to submit their products for review by the FDA.
But now we are learning that the FDA actually tried to ban those flavored products years before what is now being called a vaping outbreak. According to an investigation by the LA Times, top Obama administration officials nixed that move. Joining us to discuss this and how to address vaping is the Director of Policy Research and Analysis at the Center on Addiction, Dr. Linda Richter. She joins us now via Skype. Welcome, Doctor.
Thank you. Thank you for having me.
What do we know about what happened here with the Obama administration? Why did they stand in the way?
Well, I would say that none of this is very surprising. Essentially, what happened was what has happened for the past few decades with the tobacco industry having a tremendous influence over the regulations of products like cigarettes and now vaping products in our country. It's incredibly frustrating that the agency in our government, which is explicitly charged with protecting the public health, instead has put the financial interests of an industry, in the past the tobacco industry and now the vaping industry, ahead of that public health. So what has happened was, parades of lobbyists and consultants had come in and essentially convinced the Office of Management and Budget and therefore the Food and Drug Administration to nix their plans to eliminate flavored vaping products. Exactly 3 years ago. Had they done so as they had planned to, we wouldn't be in the crisis that we're in right now, where nearly 4 million children, essentially middle school and high school students, report on their own that they are currently vaping e-cigarette products.
Yeah. Wow. Doctor, what I hear from proponents of this is they say, look, vaping has allowed millions of people to quit cigarettes. It's a public health benefit, and the restriction of these flavored products will lead to more deaths and will receive public backlash. As a specialist in this field, what would your response to that be?
My response would be that while it might be true that some people have benefited from vaping products, the main people you're hearing that argument from is the vaping industry and now the tobacco industry, which has a tremendous interest in the financial interest in the vaping companies. The public health research, the medical research really does not support that in large part. What we're seeing instead is that kids who are vaping never smoked before and had no intention of doing so. And many adults who start vaping in order to quit smoking end up becoming what's known as dual users, where they're smoking when they can and vaping when they're not able to smoke. Essentially, in the vaping products, there's such large doses of nicotine, it makes it virtually impossible to become unaddicted. And the nicotine addiction is just perpetuated by the vaping. So we really are finding that while some people can quit smoking using vaping products, it is not a proven method for doing so. And there are proven methods for doing so where you don't end up addicted to nicotine as a lifetime problem.
And what do we know about how these vaping companies have appealed to children?
Oh, well, it's quite clear that in the original deeming regulation that was to go into effect in 2016, at the time, public health professionals knew that the flavors were the main draw for kids, and the vaping companies knew it as well, which is why we now have over 15,000 different exciting and delicious sounding flavors that these products come in. Study after study has shown that upwards of 80% of kids say that had it not been for flavors, they wouldn't really be interested in vaping, and that if the flavors were taken away, they probably would stop vaping or choose not to do so. So we know that the flavors are one of the main draws for young people to these products. Now, I don't know that an adult 50-year-old smoker who's been smoking his whole life and is used to the taste of tobacco really needs flavors like cotton candy and watermelon to switch over. If they're motivated to quit smoking, those flavors probably are not really what's needed for that particular group that the industry is supposedly trying to help.
Yeah. Doctor, we've also heard there's some recent statistics from the CDC that there have been some deaths and injuries related to vaping. And what's particularly interesting in this case is that among 578 patients recently, 78 reported using THC-containing products. But as I understand it, there's no one contaminant which unites all of these things. What is the issue specifically with THC-related products and vaping that we're seeing some deaths and now injuries across the nation?
So So the investigation is still ongoing, and nothing specific has been determined as the defining cause of these deaths. What they do know is that it's not all due to THC products necessarily. In some cases, the patients who have been affected have been just using nicotine vaping products, although the majority have used THC products. It's likely some sort of contaminant in the THC vaping products that they're getting it on the black market or getting it illegally. Some have gotten them from dispensaries that are legal. So it's really too soon to tell at this point exactly what is causing the illnesses and the deaths. And in fact, it seems to be several different things.
And doctor, within those dispensaries, I mean, these products, they do not have to be up for any sort of public health safety review before they can sell them. That seems quite concerning.
Right. So the lack of regulation of THC marijuana products across the country right now, it makes it very, very difficult to really have good oversight over the quality of the products and the purity of them, and makes it really difficult to detect exactly what is leading to cases like this, where we have over 1,000 largely young people who have fallen ill due to vaping. And it's now, I think, 18 to 21 people who have confirmed deaths due to vaping.
Yeah.
And Doctor, last question for you. Where does the Trump administration stand today in terms of their regulation of these products?
Well, the Trump administration was applauded several weeks ago for coming out and saying in response to this vaping crisis that they would move to ban flavors. However, what we're seeing really is exactly what happened in the Obama administration when they were about to do the same, which is parades of congresspeople and industry lobbyists and consultants coming in and kind of trying to undo that promise, because the industry's financial interests are at risk right now. So I would not be surprised if we kind of see the same thing that happened 3 years ago. And unfortunately, had the Obama administration 3 years ago gone forward with what they promised to do, which is to ban flavored vaping products, then we would not have the crisis of nearly 4 million kids using these products right now.
Such a great point, important point. Thank you so much, Doctor. Great to have you.
Thank you. Thank you.
Coming up, candidate Joe Biden writes an op-ed in defense of his family's business dealings, and Senator Kamala Harris says, leave Joe alone already.
And with all the machinations about Biden's business dealings, will Bernie Sanders challenge the former VP on that subject? Panel promises to be a fiery one today. Stay tuned for more Rising.